I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I would like to open up the meeting of the December 3rd Health and Human Services meeting. Call to order. Legislators Elaine Daly is here. Legislator Sargent here. Legislator Shea here. Legislator Winslow here. So we have a complete group. Our first order of business is to approve our minutes from November 12th. Do I have a motion?
So moved.
Second? Any, all in favor?
Aye.
Any opposed? Our minutes pass. We do not have any appointments coming up for the legislative agenda. So we'll go right into our resolutions and our department chair updates. And I think what I'll do is go in order of what we see on the agenda with public health first, and we'll have Deanna come up. Why don't we take care of all of your resolutions and then talk about your update? Okay.
All renewals, they're easy. I think.
Your work?
Next year.
Yeah. Okay. So HH1 is amending resolution 34925, authorizing the chair of the legislature and the public health director to enter into a contract with Cecilia Relly Wildlife Solutions.
Yep. So I think we brought this back in October. Am I okay to keep?
Correct. Yeah.
And so there was an error listed on the hourly rate, and then we neglected to include the capture and the trapping rate. So those are the two additions listed. This is for rabies prevention, or I'm sorry, rabies specimen prep, euthanasia, and then if necessary, the capture and the trapping. We don't typically capture and trap unless it's absolutely necessary. But you'll see another resolution tonight for an additional wildlife person to help us too. So this is a way that we are trying to have options for contracted vendors, as we do have our current contractor retiring at the end of December.
I'll move HH1.
Discussion? Thank you. A second.
A second.
Any discussions or questions on the amended resolution, or the resolution for an amendment?
Just rate changes, really.
Yeah.
Yes, okay. All in favor?
Aye.
Any opposed? HH1 passes. HH2 is authorizing the chair of the legislature and the public health director to enter into contract with East Hill Family Medical Services and the Finger Lakes Community Health for the provision of STD services. This is a mandated provision.
Yes, we don't do this work in-house. This is mandated, so we contract with the two agencies for participants, patients to have choice of provider. And this provides someone local in the city of Auburn and then also someone in the northern part of the county. These are just annual contracts for STD services. The rates are set by Medicaid for those who have Medicaid. And we are only responsible for what insurance does not cover if someone does have private insurance at the Medicaid rate.
I'll move that.
Second.
The cost of this contract, since their billing is much lower than it's usually ever been, right? You're just a deficit funder.
Yes, we're basically just,
Yep.
whatever isn't covered.
They're both FQHCs, right? So if they're not insured, do we pay or does the FQ pay?
They try to get them enrolled in insurance, and sometimes for confidentiality reasons, people don't want their insurance billed, so then we would pick that up.
Okay.
Yeah, I think the county has to provide sexually transmitted disease services, so if they're uninsured, that's who we're paying for.
Yeah.
correct?
Yes, unless, yeah. And if their insurance doesn't cover something, but I don't think we pay those two vendors quite a bit of money. It's small amounts.
Because those types of clinics are funded to serve here too.
Right.
That's what, so.
But there are contractors.
Got it.
It's our obligation to do it, not theirs.
Correct, yeah.
Mhm.
We'll move that back to us. Any other discussion or questions? All in favor of HH2?
Aye.
Agreed. Any opposed? Hearing none, HH2 passes. HH3 is authorizing the public health director to fill one senior public health sanitarium, it's a health program position, or a sanitarium health program position due to a resignation. So this is budgeted position. This has gone through personnel committee review. November 4th.
I move it and are you seconding it, Bob?
Yes, I am.
Okay, I have a question. What title are you actually filling behind? The public health
So right now, it
engineer or a senior?
senior sanitarian,
So you had someone in that position and that has left?
correct.
Okay, so if you can't find the senior, you'll,
Yes, I would like to have to not come back like we did with WIC and all of that. So that's why it's one or the other.
And that the two titles give you more options and possibly more candidates to choose from.
Yeah, for recruitment purposes, but it's one position.
because the senior has to have experience and in addition to whatever requirement.
Yes, I think they have to have 2 years of experience as a sanitarian. So there's specific requirements.
Right.
And we know that the use of the word create here is because of help.
Right.
Any other questions, discussion? Hearing none, all in favor of HH3?
Aye.
Aye.
Any opposed? HH3 passes. HH4 is authorizing the chair of the legislature and the public health director to enter into contract with Finger Lakes Wildlife. So again, this is rabies related. You can get us up to date on it.
Yeah, so this is another contractor for wildlife specimen preparation. So you'll see that their rates are inclusive of all of the items listed. And person is a Cayuga County vendor. The other individual does not live in the county. So we have a couple options for us right now for wildlife, and we are securing other vendors for domestic animals.
It's great that you have found vendors because earlier in the process,
It was a lot of effort to
Yeah,
find
yeah.
people, yes.
good work. Thank you.
Yes.
I'll move HH4 if it hasn't been moved.
I'll second.
Any other questions, discussion? Hearing none, all in favor of HH4?
Aye.
Any opposed? HH4 passes. HH5 authorizes the chair of the legislature and the public health director to enter into a contract with the Board of Health approved hearing officers to conduct administrative hearings for Cayuga County.
I'll move that.
I'll second.
Okay.
Yep, so this is just an annual renewal for our Board of Health hearing officers. They recently, I believe, had an increase in their rate, so the $50 is accurate for what we are paying them. We try to have Board of Health hearings monthly. Sometimes we don't have to bring anyone to a hearing, so they don't have work, so it's kind of as needed.
There's two current hearing officers.
Yes.
Any other questions, discussion?
Just want to make sure we highlight, there is some state aid reimbursement for that work, so.
Yes. Yes, it's funded through state aid reimbursement formula. Okay, hearing questions or discussion at this point, all in favor of HH5?
Aye.
Aye.
Any opposed? HH5 passes. HH6 is a resolution authorizing the chair of the legislature and the public health director to enter into an intermunicipal agreement with Onondaga County Health Department for the provision of tuberculosis control program.
I'll move HH6.
Thank you.
Second for discussion.
Okay, so this is for us to perform the required medical oversight for suspected and confirmed tuberculosis cases. Years ago, we had private physicians that worked with us and specialized in tuberculosis. And we found we were in need of this last year, and we were looking at contracting with other physicians. And the Onondaga County agreement ended up working out to be more cost effective than some of what the other providers were looking at. So we did enter into a 1-year agreement with Onondaga County last year. We're looking at this one to be a 5-year contract because the Onondaga County process takes a long time for contracts to get signed. So we still don't even have the finalized contract from this current year back to us yet.
And it includes a rate of $220 per initial visit, $130 for the follow-ups, and the opportunity for telehealth at $130.
Yes,
$130 per consultation.
We included those rates just for transparency. So this provider will help us with the medical evaluation, but they also are ordering the imaging and the laboratory tests, as well as prescribing the medications that we are required to observe the individuals taking when they are positive.
I know you had a recent case and we're not going to talk about that, but there are years where there are no active TB cases in the county. So it's not a common thing, but.
Right. And this will allow us to use this vendor as needed, whereas some of the other physicians, they wanted almost like a retainer for them to be on call to us. And so that was going to be more costly than going this route.
Yep.
There's not you don't need to budget largely, but it's just a handful if you get any.
Yeah, some years we don't have any there. I think there's been a couple of years in a row where we didn't get any. And then some years we've had 2.
Yeah.
Yeah, it's hard to estimate what we're going to get.
You hope to have none.
Yes, because if we do get a confirmed one, we monitor them for a very long time, up to a year. So.
And the funds will come out of the professional services line of your budget.
Really?
Yes.
For infection control.
Mhm.
Any other
Expensive.
questions, discussion? Hearing none, all in favor of H86?
Aye.
Any opposed? H6 passes. H7 is authorizing the chair of the legislature and the public health director to enter into a contract with the county's information technology department for provision of services.
I'll move it.
Thank you.
A second.
So this is a desire to maximize the state reimbursement for existing county expenses. It's kind of an inside collaboration between departments, which I love to see.
Yes.
You actually exchange funds. They send you a bill for the IT support and you pay them, is that?
I think, or it's journal entry back somewhere behind the scenes. Yes, I think. And so we can claim some of the IT expenses and the hardware for security through some of our grants. And then I think we also charge some of it to state aid. I don't know if we've had annual contracts in the past, but this one will be a 3-year contract. So you'll notice for 1 year, it'll be 60. And then the other 2 years, it's up to 75. And we worked with Tom on that. So.
Yep, and that's hourly.
Yep.
Any other questions or discussion? Hearing none, all in favor of HH7?
Aye.
Any opposed? HH7 passes. HH9 or 8, authorizing the chair, the legislature, and the public health director to enter into contract with SPCA of Central New York to provide rabies vaccination clinics. And I see that it is, can I have a motion?
Move it.
Second.
Okay. I see that it's a contract to provide at least 3 clinics yearly.
And so these are for domestic animals, dogs, cats, and ferrets. And they typically offer them right on site at their SPCA. This year they were doing renovations and they hosted one of the clinics at the mall. So even though they were under construction, they still performed the 3 clinics that we require or ask them to. So again, we subcontract this mandate out to them. And I believe this is the same amount that we had contracted for them last year.
And you still get rabies funds to support this
To
work?
offset, yes.
Any other questions, discussion? Hearing none, all in favor of HH8?
Aye.
Any opposed? HH8 passes. Hi,
Okay, I
should get us up.
didn't have anything formally prepared, but I do
Well, we're
have.
meeting earlier than we normally do.
Yeah, but I do have a couple things to make you apprised of. So following the new grant policy, I wanted to make you aware that we're applying for a small climate change grant through NYSHO, which is the New York State Association of County Health Officials. The total dollar amount is up to $3,000. We were awarded this for 2 years in a row. One time we focused on harmful algal bloom, education and outreach where we did direct mailers. And the other grant year that we had the funds, we did tick kit education in a campaign. So we provided tick kits out in the community. Last year we were not awarded. And so this year we're looking to enhance the grant application to just offset some of the required mandatory work that we're doing seasonally in the summer. It's a 6-month grant. We're just looking for education and outreach funds. And then we are going to look at purchasing more tickets because those were very popular. And this summer when we didn't have them, our office was getting a lot of calls that people wanted. Just, it's a little kit that has a tweezer, an alcohol prep pad, and some Band-Aids. So simple things, but they really enjoyed that. And so we're going to try to, if awarded, use those funds to provide them throughout the county.
Yeah. I think it's
Partnering with
important.
libraries, town and village offices, and other organizations throughout the county.
As simple as things like that seem, it totals toward the kinds of services that are varied across all of our services that we provide for our public, our constituents, our citizens.
Yes.
Yeah.
And we're monitoring all of the tick-borne illnesses that are reported to our office. And so we're collecting that data and analyzing if there's been an increase, and we'll demonstrate that in the application.
And it fits in climate change
Yes.
Yeah.
Yeah.
because of the,
We're seeing ticks that were typically kind of more in the south migrating now because we've had warmer winters. They're not dying off. So there's an increase in the tick population as well.
so they made that connection and qualified that.
Mhm.
Yes.
So I just want to make you aware that that's something.
This is new grant policy? Is that?
This is the form. Yes, yes. So I just wanted to make sure I was following, what's required. I'm sorry, I can pass that. And we would do tick education anyways. But we just wouldn't have the funds to purchase the kit. So it's just offsetting work that we do. Another thing I wanted to make you aware of is that our November Board of Health approved an increase in some permit fees for mobile home parks and temporary residences. I kind of compared what, the permits were for 2025 versus 2026, and it looks like it'll be an additional $5,500 in revenue for our office with the increase in the fees. And it just kind of aligns with the additional workload that we've had. We haven't updated those fees in probably over 5 years.
Yes. And you, at the time of your budgets, you said you were going to take a look at those things and make sure that they were kind of in line with other counties.
In line with other counties and in line with the staff effort that goes into each. So, in line with what I've been trying to do, with updating you about some of our programs, I worked with, early intervention, preschool special ed, staff to compile a little sheet related to our programs, for children and youth with special healthcare needs. That grant ran the same timeframe as the 2 programs I presented on last month. So it's an October 1 to September 30th grant year. And I just wanted to highlight some of the work. It's a small amount of money that we get to offset some staff salary and fringe, but we also host community events. This past year, we did a lot of our events at Play Space at night and some on the weekends. The events are always open, free and open to the public. But the intent of this grant funds and these guided play nights and the community resource nights is to have those families that are on wait lists for services within early intervention and potentially preschool to have a forum to connect with other families and providers and have information be available. So, if they're working with a speech therapist, that speech therapist at that guided play night might provide them with tips that the parents can or caregivers can use in the home while they're waiting for services.
People are taking advantage of it?
Yes.
Yes.
Yes. So down on the bottom kind of just highlights that we hosted 7 events this year in partnership with Play Space. There was an average of 25 to 30 families at each event, and our largest event drew over 115 participants. Take-home supplies are given, and those are kind of like tools or toys that are developmentally age appropriate for, the topic they're talking about.
Manipulatives and
Yes,
Again,
fine motor,
toys
gross
and-
motor, yes, different types of tools and toys. So I won't read through the whole document, but I just wanted to provide a little snapshot and stories about the work that staff are doing. And the Children and Youth Coordinator, Tracy Blair, she kind of compiled this. So I wanted to give her credit for the work that she put into designing this little one-page resource.
Thank you, Forrest. It's very informative.
Do you know on average how long people stay on a wait list?
I think it depends on
where they live
service.
in the county and.
It depends on the type of service that they need and then where they live, yeah. Mhm. And we use the feedback that we're hearing from families to kind of shape the the guided play nights that are being offered. So it is tailored to them and their needs. We're also looking for this year, we haven't received our contract yet, but we're looking to host other events at different locations throughout the county to serve a broader, network of
Southern
people.
tier, northern tier,
Yes. So.
like Keto, for instance, as a community center.
Mhm. Yes, I think looking at BTW and other places in the community schools would be a great location. Play space is nice because families can go there and utilize a lot of the equipment and toys and plays that, are going to support their child's development. So play space has been a great opportunity, but we're looking at trying to meet more people where they are at. Yep. Okay, I think that's all I have. Sorry, that was a lot, but.
Thank you.
Thank you, Jen.
Okay. Then Marshall is here to represent Bianco for social services. And we do have any?
We have one resolution.
It's stapled on the back, that's why you can't.
I might be looking at. So it's. 09. So this is amending the social services 2025 budget to accept state funding for the shelter arrears eviction postponement SAFE program.
Yes,
Remember doing this at this time of year last year.
yes.
Can we have a motion to put this on the paper? On the
I move.
table?
It says 1225.
Yes, and if you go to your email, Miranda sent out a revised.
Oh, okay.
HHS, early this week. It's early this week. Maybe on Monday afternoon, Tuesday morning. Because the revised agenda did change all the numbers of the resolutions.
Use the attached, well, this is the attached revised agenda, and I think it is, the date is not right, I don't think for.
Yeah, so when I got on Monday.
Yeah.
Stop before if you need it.
Okay, I just want to make sure I was on the right one.
Did we get a second or did the two sleepers stop? We just.
I'll second.
Thank you.
Are you calling us sleepers?
Maybe.
The shoe fits? He called you a sleeper too.
So it's
Awaker.
this year you received 69,440.
Yes, and it's actually the same amount that we received last year. They do think that they're going to give us additional money, but they have not yet said what that is going to be. So we want to definitely accept the 69,443, and then we'll come back if we need to amend that and accept additional funds. And this last year, we were able to help 22 households with rental arrears to not get evicted.
That's kind of the goal. If
Yes.
they're behind on the rent, they don't have it.
Yes,
They're going to be evicted if there's.
correct.
This is a one-time service, like they can only utilize it once.
It is. It is.
Even if you get more money, could the same family use it? So
In a different year.
in a different year.
Yes,
Just want to.
yes, yes.
And you found that by helping those families over that eviction hump or the arrears,
That
that
then
they stay on track after that. You don't
Correct.
see them.
come back and
come back and
present as homeless.
Okay, great.
Yep. Yep, and that's the point. So
Any questions or discussion about HH9? Hearing none.
Sleeper one says, I'm in favor.
Sleeper two.
Yes, all in favor? Aye. Any opposed? Okay.
So I have a few updates. Wanted to let everybody know that the regular HEAP season is now open as of Monday, December 1st. And that will run through April 7th of 2026. Applications are being accepted and in person and through the website. And there will be one additional emergency HEAP component that will open on January 2nd.
Is that later than normal? Is that, I mean?
HEAP?
Yes.
Yes, it's much,
January is late. Oh, all of it's.
all of it's later. Yes, because of the federal government shutdown. So yes, everything is later. But it's good that that is now finally open. We were getting very concerned. The second thing that I want to talk about, and pass these out to you. This is not great news. So for the first time in the history of the Cayuga County Department of Social Services, we have to begin to deny childcare applications for childcare assistance due to the funding shortfall.
That's daycare,
Daycare,
Yes, right.
yes. Our current allocation is $2,610,824. And we've been reviewing ongoingly the rate of spending for the childcare assistance based on our allocation. And we have determined that we will not have enough money to carry the program through the federal fiscal year of October 25 to September 26. And we believe that if we were to go at the same rate that we are now, that we would run out of funds by April of 2026. And this is a program that we do not use any local dollars for. So we have to stay in the 2.6 million. And with this program, when we certify someone is eligible, they are given the program for a period of 12 months. So we have to guarantee the 12 months. So it was imperative that we made the decision to stop approving any new applications as of November 17th. So the letter that
And that can't reopen at any time?
so it's probably not going to reopen until we get our next allocation, but we'll continue to monitor it.
When's the next allocation?
Not until October of 2026.
So essentially from now till then, new families won't be put on the program?
Correct. There are some that we absolutely have to fund, which is in the letter as well. But based on what we have right now, we have approximately 246 families that we are funding. And that some of them will come off based on when their recertification period is. So each month, starting in February, we're going to accept applications for recertification, but we'll deny them based on the funding shortfall.
I guess I'm trying to understand. I know other counties, you had a lot of rollover
We did.
that was available. That's why other counties probably ran out before you did.
Correct. But
the eligibility is pretty high.
the eligibility is why we're running into this shortfall. So that's also in the letter. So New York State changed. We used to be able to have a parent share that would contribute to the childcare assistance, and that was up to 35%. Now we cannot, it's 1%. So it's $1 that they have to contribute. And also New York State raised the eligibility to 85% of the state median income. So a lot more families were eligible to receive assistance. And the other thing that they changed for the providers is that they can now bill us for up to 80 absences for if the child is not at the daycare facility or whatever, they can still bill for their time. So
the rub was we need more providers.
we need more providers. They increased the amount of money paid to the providers. The rates that that we have to pay and put these stipulations in. So we have a lot more people that are eligible,
And.
but they didn't give us any more money.
Much less parent share.
Right.
You don't, is it a first come, first serve? You can't like prioritize the people that need it the most or anything.
So we have to guarantee, so, right, the TANF. But after that, no, it's first come, first serve. And it could be, it's going to cost different if you have one child compared to 3 children and the ages of them too. So
So families on temporary assistance who are employable and need this to work, they're going to get daycare.
correct,
Even after right now, November, you have enough to provide for.
correct,
It's the families not on assistance that with a low enough income to qualify that will go without. Is that,
correct,
yeah,
correct.
I'm sure that's
So-
a popular phone call.
Right. So it's really, I wanted to make sure that you had what we sent out to the providers, because the providers are also not going to be happy with this either, because they're going to lose.
Right, they're going to.
People. And so I would imagine that you will get phone calls. So, obviously, yeah, I'm sorry. I'm sorry, but I mean, we certainly don't want to have any local share to this expense. So it's what we have to do. And we, with the recertifications, we're giving them 2 months. We're not going to start that till February. So we've sent the letters out so they know, the people who are being recertified in February know that in February, they're not going to be getting the supplement anymore.
So they're federal funds, but the state changed the rules.
They're federal, yes, they're federal and state funds, but yes,
Okay.
yes,
The only hope is that the funding will increase next.
correct. Right. We've been lobbying with the state. We had a phone call with them last week and we're continuing to let them know we have to report to them what we are denying and they're good lobbying as well to try and get more funds. But as of right now, this is the situation that we're in.
Forward, will you be able to keep the stats on how many we had to deny?
Yes.
Keep us up to date. on
Yes,
what happened.
and I will send this out. I'll email it to all of the legislators too, so that they're aware of this, so that they know as well. Other questions? Sorry, that's awful.
For you too, I'm sure that's not easy to tell people.
No, and we actually have a lot of foster parents that
Right.
so it's gonna affect
Their job.
them as well.
A ripple effect.
Yes, yes, so it's,
It impacts childcare.
To work.
Impacts
Correct.
foster care to the point where foster care providers.
They
are
won't.
Exhausted and.
Right.
Don't have that.
At one point, my entire
respite.
paycheck went to day. I remember I just
Mhm,
paid to not be with my kids. It was very confusing.
mhm, mhm.
That's tough.
Yeah.
It's really tough.
It is very tough. On some more negative news, homeless numbers are up. As of last Wednesday, we were housing 138 singles and 21 families. That's due to, it's now executive order, code blue. So it's under 32 degrees. So we are housing more people.
And you just get an allocation for that, but. still.
We do.
Yes.
Yes, yes. But that definitely is why the numbers are up. And I think that that's it. I do want to just publicly thank the Department of Social Services and its employees. This year has been certainly a challenge with external forces, with the federal government being shut down, and then internally with the building and, losing allocations for different things that we have been doing and down staff. So I just want to give a shout out to them to
And I
thank them
I think this
for that.
community
And
would like to do the same. I think around the table, we would all agree
thank you.
on all
you.
of those hardships and yet the commitment to continue.
Yeah.
to do
Yeah, I appreciate them showing up and
important work.
getting the services out.
Really driven by the mission of what they're doing, because
Mhm.
it's not for the pay or the revenue. It's a tough job.
Yeah, yes.
Yeah, please tell them thank you.
And thank you to you guys too. I know it's not easy to sit in your seats either. So I appreciate your commitment to everything that you do for the community. And hopefully after next week, and take a couple weeks off to enjoy the holidays. Before you get started in for next year. Thank you.
And our best wishes to Christine.
Thanks. Thanks. Let her know that.
Okay, Brenda, Office of Aging. I do not believe you have resolutions to, so if you'd like to get us up to date on.
Yeah, so our office continues to provide the assistance, the support, and services that I've been reporting on for the last year. So you have any questions for me? I really have.
Well, I have high regard for the work that your staff and all of the programs that are happening and the volunteers as well who make it happen. I'm someone who has been able to benefit from OFA, having been the caregiver of an elderly father. I did reach out to OFA when during those years and got assistance. And, you know, I'm just one example. And I know as an advisory board committee member, the stories out there are really as large as the senior population is.
They are. Thank you for sharing
Very
the letter.
few people get, yeah,
The letter from our
very few people
caregiver.
get through the older parts of being a senior without
Right.
needing some sort of help. And a lot of times they do have family help and
Mhm.
those kinds of things. But,
Thank you.
many times it's Office for Aging that needs to pick it up, and I
Mhm.
appreciate the work they do.
Yeah. It's,
And, you know, from the point of view of being an advisory board member, this is a very committed and happy staff. It's a team.
right.
It's a team. The advisory committee is a pleasant experience for me because I see that teamwork and appreciate the cross training that you have done and started to do back when you were down in the basement.
Right.
It's been, you know, and that was one of your goals that you met a long time ago. So
Right. Necessary for service.
I do appreciate the work all year long.
Thanks.
I'll be one of those folks who will be utilizing your services this year. This is my Medicaid birthday year, Medicare birthday year.
All right.
So,
Put you on the list.
yeah.
All right, good. Well, thank you.
Thank
It's
you.
it's wonderful.
Are there additional things that you need around this time of year, like the holidays, or do you have more requests for things? Just weather probably is tough too.
Heat and food, just like, you know, for everyone that's been dealing with the SNAP and the heat has been the biggest issues. And now that that's opened again, that'll help somewhat. We're fortunate there's Santa Fe Seniors that Home Instead puts together, so that is available for those who are in need. Yeah, just our usual, you know, snow brushes for the drivers. I don't, you know, we will be thanking them in the next couple of weeks and providing them with a small gift, our volunteers that do so much through the winter, and some treats and things. So it's always
There's
nice.
a lot of people that can't leave their homes in the winter and
Right.
I don't know.
That driver,
And then
that
there's a
meal
lot of
driver is who
brave,
they see. Yeah,
souls who do that winter driving to get the meals out there.
that is true.
Yeah.
Yes, they're incredible. Absolutely incredible.
Well, please thank them from us as well.
Yeah.
Sure, I will. Thank you.
Yeah.
Sure will.
I always love being at the celebrations for that.
Yeah.
You do a nice job with gratitude.
That service. All right.
Thank you. We have a resolution up next from, or we passed it, from the Youth Bureau. So aren't we? Ever Dennis come up? This is HH 10. And it's authorizing the repeal of a resolution number 57 4 termination of an agreement with Southern Cayuga Future Farmers of America and authorizing the chair of the Cayuga County Legislature and the director of the Youth Bureau to enter into a supervising agreement with Growing Hope Cayuga Incorporated for Growing Hope demonstration projects. So this is an amendment which is kind of moving the supervision of the funds to another organization, but with the same mission. This, nothing changed in the ARPA application except for.
Right, who the contract was with. This was an original of one of the ARPA programs that I'm still working on. This was a co-application with Growing Hope Cayuga with Southern Cayuga Future Farmers of America. Based on just the grant itself and the ease of being able to make this work happen. I spoke with Growing Hope Cayuga. They want to take it over to put the scope together. The original scope would stay the same. The individual with Future Farmers of America at Southern Cayuga is still available. She just doesn't have the time as originally thought to make this program happen. So everything would stay the same, except for we would recontract with Growing Hope Cayuga, who was part of the program to begin with, to do these services by the end of 2020, December of 2026, when the ARPA funds have to be spent by.
We have a motion on the table?
Do you need, yes.
One of the things I'd like to say about this project, and we talked about it a long time ago when it first looking at applications, but it's really quite interesting what these young people are doing. They're growing food and they themselves are learning about that process, sticking with that process, and then they donate that. They prepare and donate that product, those food products to the food bank in their area. So there's so many pieces of community service, community work, and education around agriculture.
I agree.
Yeah, and easily sustained.
And that's part of, I can talk about that after, but I know one thing that they're doing too, to just kind of talk about the sustainability. They have an open house this upcoming Monday at the Equal Rights Heritage Center about the Growing Hope Cayuga project. And they're going to be doing some networking and brainstorming and invited a lot of other youth organizations in the community to come together so they can kind of start collaborating with more people to work on this project going forward.
Is the project to expose people to farming?
Just agricultural, but they also want to do, to work on just information to get more schools involved. So it did start off as like Future Farmers of America, which is farming and agricultural, but FFAs also do things like with like flower arrangements and obedience training for dogs. They do different things, besides just the agricultural aspect of it with FFA. So it's just kind of working on those type of projects with other youth besides just Future Farmers of America groups, because a lot of school districts don't have those. But this is something, for instance, that Cornell Cooperative Extension could be interested in, 4-H programs like that.
And the ARPA money that you're allocating is used for the program itself? Or?
Yep, the program itself. So, and then one part of the thing that they're going to do is some of the ARPA funding, they're going to help with seed money for some smaller projects off of that Growing Hope project to help some of the smaller organizations get started to do similar projects. And they're going to kind of be the lead for that.
I love that one of the missions around this is focused on local hunger relief. By young people, taking that kind of community service, truly, from start to finish to our community that's vulnerable.
It's great.
Any questions or discussion? Okay, all in favor of HH 10?
Aye.
Any opposed? HH 10 passes. Deborah, do you have any?
Just a couple. I wanted to just again let you know on Monday evening they are doing the youth program, hands-on food agriculture projects in Cayuga County. It's just kind of like an informational networking session. going on with that. Just some other interesting, I guess, exciting things going on with youth in the, just some youth things currently going on that kind of is an extension of some of the work that the Youth Bureau's allocations have been able to help with. I'm sure we've all heard of, hopefully, the Hideout Gaming Center, which is open in the Genesee Mall downtown. Their new center is beautiful. I don't know if you've had a chance to see it. I know that Heidi has done such a wonderful job. They have a great location. They have some really fun upcoming things, such as they have an Uno competition, Fortnite tournaments, a Santa toy drive, a New Year's Eve game time party. On Thanksgiving, they did a film night. So they showed movies.
Location you funded, Youth Bureau funded?
Yeah, they were out by the mall at the old Garapi's restaurant. And so now they're in the Genesee Mall now.
The Genesee Mall.
Yep. So they're getting a lot more foot traffic for sure.
It's.
Yeah, it's really
I was
nice.
there for the ribbon cutting at the new location and have been there since, and it's dynamic.
Yeah,
And other programs use it
yeah,
and contract with them. Booker T will contract with them,
Mhm.
bring kids in for these kinds of experiences. Kids who don't have experience, or opportunity to use these digital games and,
Mhm.
don't have the money to do what other kids are doing.
and I like because it's not just they do have the video games there, but they have like the old style games there too. They have board games. They have just kind of a sitting area if you just want to kind of sit and socialize, if you're not into the VR headsets and things like that.
Sustainability, it will end up, you gave the seed money and.
Yeah, because they do charge a membership fee. They do have, donations to use everything. They have scholarships available. They also, if one other thing that's kind of nice that they do, if a child can't pay, if they're old enough, they can kind of help out and volunteer. And they kind of earn points towards gaming certificates to play the games there.
And I don't know if you've talked with both of the Daryls, but one of the spring programs that they'll be initiating that I'm just gonna, be volunteering with them, and I'll put this out to the world that's watching and in this room, looking for tutor volunteers, but they're going to have a free tutoring opportunity so the kids can come in right after school,
Mhm.
get their homework done,
Mhm.
and then,
Oh, that's great.
enjoy the recreational piece.
Oh,
And
wonderful.
it'll also be, an opportunity to get that work done and be diligent, but, an opportunity again to participate through the proof that they're on track
Yeah.
academically, and give them coins or
Mhm.
rewards toward playing the games after
Yeah.
homework is done.
Oh, great.
So looking for tutors and homework assistants, nothing that requires.
I'll say, as long as it's not math, I
It
can.
doesn't require a teaching degree. It just really requires a lot of mentoring and encouragement.
Mhm.
Yeah.
I know they were a little disappointed. Their goal was for them to be open at the beginning of the summer, but they had some heating or some air conditioning issues, and it was very hot in there. So that's why they had a summer camp planned, which I'm sure they'll continue next summer, since they weren't able to do it this summer because of HVAC issues they had in the building, but everything is going well with them. And just some other things too, and I think will be good for, to kind of collaborate with these different groups, just to kind of let everybody know what's going on. I know that Cayuga Counseling, they are still doing their weekly kids club. It was canceled last evening due to the weather. But before that, the week before Thanksgiving, they actually had a roller skating party that was really well attended, and the kids really enjoyed that. So every Tuesday from 4:30 to 6, they do a free kids club program.
Where can kids roller skate now?
I think they did it at the mall.
Really, is that open?
It's not, I think you could rent it out. So they coordinate or kind of contract with an organization that comes in and brings the skates and everything for
Oh,
kids to use. Because other groups have used, I think it's the old,
It's the old one up top?
no, it's
I think that's.
I think it's where, I don't even know what store it used to be.
Oh, I see. In one of the.
I think they used to do, yeah, one of the older areas downstairs. I think it's where they may have done like the COVID vaccines. It's kind of like
Right,
a
right.
large
That
open.
event
Larger
center.
area.
Yeah, the event center. Yeah, I think that's what old
I
Stephen
remember there was
Barry,
a
but I don't
private
know.
individual trying to revitalize.
Yeah.
Yes, but I think there's some,
Roadblock,
yes.
5-star guy.
But I did read that there's roof issues with leaking, so they're not moving forward with the project. Fortunate, but hopefully maybe they could find another location.
That would have been neat.
Yeah. And then the 4-H has a Spark Club. They meet on Tuesdays. Youth 5 to 18 are invited. Attendance is free and all materials are provided. They do things about, they call it Spark, to try to spark people's interest in different things that they do. So basic bird identification, coding to run a Lego robot, planting and growing your own edible herb garden. And one thing that they are doing, they are in January, I just found out today when I met with them, they are opening a small maker space right on not Logan Street, what is that street, where Arise is on the corner there, Lincoln.
Lincoln,
In January, they're gonna be opening a maker space, so kids can go there and,
be entrepreneurs.
yeah. Yep, so that'll be something else different downtown that kids can do. With the hideout and the kids club and different things down there. And then for our rural friends, Town of Montezuma, their youth programs are really going very well. They've already so far, since they can backdate their youth bureau funding through, because our funding is on the state year, so it's October 1st to September 30th. So they've already done a video game night. They're going to be doing decorating cookies with Santa at the town hall. They're going to Disney on Ice, December 27th. They're doing a family ice skating at Casey Park and the Rochester Museum and Planetarium in February over break. So they're offering a lot of neat programs for the kids in those rural communities to do on their time off.
And I saw their schedule. I don't know if I saw it online or something, and it was full.
Yeah, the kids are really excited about it. So,
How often? It's like every 2 to 3 days.
yeah.
They've got something going.
And I think the youth, I know our board is happy because with the progress with moving out into the rural areas, I know it's one thing when I had first started and we all had gotten together just to try to get some programs out to the rural communities. And I think we're doing a really good job with that. So that was just kind of one thing that I think is going well.
I think there's a real recognition of how much you've gotten outside the city.
Yeah.
Definitely.
It's nice to kind of, to see it spread and word of mouth, which is good, but then we get a lot more applications
Right.
when the word of mouth comes out about the funding.
It's
So
hard to be the advisory committee, but
Yeah.
it's exciting.
long
see
night to go
what's
through everything. But that's all I have. If anyone has any questions. Okay.
No,
thanks.
thank you very much.
Thanks.
Right, so,
Sorry about long.
Lauren, if you'd like to come up and we'll deal with resolution HH 11 first, authorizing the Director of Human Services and the Chair, Cayuga County Legislature to accept state aid and sign contracts with various human service agencies for the services to individuals with disabilities.
I'll move along.
Thank you. Okay, so this is 100% state aid funding. This is quite a big, where's the number? Help me find the number, but it was quite a big new allotment. Well, I guess you can see.
It's divided up between
The
the agencies.
Where's the money that goes to you in mental health?
We don't
You don't report it.
necessarily put it in this
Portion
resolution.
of it
Yeah,
to support the services.
correct.
But
correct.
this is
Yep.
referring to.
This is for all the contracts for the other agencies. Pretty standard. We do this resolution yearly. And obviously the state aid amounts change based on the COLAs and what we're expecting for the following year.
Any questions or discussion? Would people like me to go over the allocations if you haven't seen that? To Nick's Ride, Cayuga Counseling, Veteran Service.
I'm gonna abstain from the vote.
Well, hearing no questions or discussion, at this point, all in favor of HH 11?
Aye.
Any opposed? HH 11 carries. And HH 12 is authorizing the creation of one full-time health home care manager, a help position at the mental health center due to a termination. So,
I'll move that.
looks like, thank you, looks like creation because of health.
Yes.
And this has gone through personnel.
We actually just approved it in October. It was on the.
Oh, I didn't know if you had another
last.
one. That's the same
And
one?
yes, there's two.
So
And
we have two health home care manager positions and they are both vacant. So this is the second one.
you filled one and then the employee terminated the employee.
Yes.
Now it's open again.
Yes. So there's two positions. They're both open. So we're doing the best we can with managing the AOT clients, especially
Oh,
because we're the only provider that can
Yeah.
service them, as well as there's a lot of non-Medicaid, applications still coming in. So we're doing our best to, we have some applicants, so that is hopeful, and hopefully we'll start interviewing them next week, and hopefully we'll hire one or two soon.
There are minimum quals, I'm asking.
There are.
There's no test.
Correct, there's no
No,
test, but the qualifications are set by the state, not necessarily by us. There's no movement on, civil service requirements because of that.
And this is a bachelor's level.
It
position,
is,
not
you do need a
licensed.
4-year degree.
Yeah.
Yes, yes. Yep.
Any other questions, discussion? Hearing none, all in favor of PJ 12? Any opposed? PJ 12. Okay, that finishes our resolutions for the evening, and do you have a report for us?
I just have a couple updates. We just got the reports for our clinic visits we kind of finished up on October. And that was our first month in a very long time of being fully staffed with social workers. I just want to kind of tell you like the numbers. On average for the first 9 months of the year, we averaged about 2,200 visits for the month. October was 400 more visits, up to 2,600 visits for that month. And I think it is directly related to the amount of staff that we have. So I know we always talk about that, like the more social workers we have, the more clients we can see. And that's just, I know it's only the first month, but I just wanted to share that because I was very happy with that number. So I just wanted to,
Since you have open enrollment, then you can potentially see them more frequently even too.
yes.
Yes, because you are serving everyone, but you can do a better job.
Correct.
of the frequency that they come back.
Yes, it allows therapists based on, the level of need for that particular client to be able to get them back in sooner.
Yep.
Like they would need to versus, I don't know, we run into problems where someone comes in for an intake and we don't have an opening for, and they should be seen within 2 weeks, when they first come in. So, I would say we're doing a really good job at that. Still busy. Our clients, as far as our census, are still, well over 2,000 clients that we're serving. So, I am happy to see like us fully staffed. It just shows that, I think with everything happening in the world these days, I do see that mental health need has definitely been rising, and we've seen the level of, the degree of our clients that we're seeing in the community, whether that's, law enforcement would probably agree with that. We've had mobile crisis has never been this busy during our, the daytime hours.
School SROs would agree with that.
Yeah, the need is just rising and we see it daily. So I'm so happy to have our fully staffed social work wise to be able to serve the people that need them in the way that they need to be served. So that was the one thing I wanted to share. The other thing is as like this year kind of closes, I just want to say like, I hope you've really noticed the work we've done on the 730s and in the restoration. We put a lot of time into like really advocating and teaching and educating what that really is. And actually, we haven't had anybody go to the hospital this year because of competency. We've only had 2 people go to the hospital from jail because they were too mentally ill to be served in the jail, which is different than a 730, but it's all in the same budget line. So there is a degree of people ending up in our jail that are really
Sick.
yeah, and they really need help and they need the hospital. So we've done, we did what we could. OMH has, they have to accept them into one of their state hospitals, and those 2 individuals really needed that. And I think it really, really helped those individuals out.
And that requires, I'm asking, an evaluation and assessment by your staff prior to them going to the 508 or whatever.
Yep, so the 508 is a bit different. There's a lot of paperwork required. There's what's called a 2PC. So you have to have 2 psychiatrists evaluate the individual, not psychiatrists, 2 doctors, 1 psychiatrist, to be able to even apply for that 508. Obviously the jail has to say this person, it really is the sheriff and the jail asking this person is too ill we can't care for them in our jail. And obviously our social workers put all the information together based on their assessments and their intake. And when they see that person, all of their notes go to OMH for them to review. Then they decide whether that person gets accepted into the hospital.
OMH makes the decision about the 508.
Yes.
Okay.
Yes.
Mhm.
So that's why that's why the DCS is involved, because it has to do with OMH, and then they determine how long that person stays based on whenever they're ready for discharge.
In the 730s, it's the court. that makes that decision?
Well, the hospital makes a decision when the person can be discharged from the hospital. The same thing, the hospital, once someone's in the hospital makes the decision whether a person's restored or they're well enough to return to the jail and then, go to trial.
Okay, I just, the order to.
It's complicated.
Yeah, the competency is.
Yes, anyone can order for a 7:30, anybody in the court system, a defense attorney,
Okay.
prosecutor, the judge, anybody can ask for that and everything stops until that is
I
completed.
didn't realize that.
Now, the judge has the final say though. So even if because we've had a situation where our psychologists have said, this person's not competent, but, depending on a lot of factors, the judge can then determine whether they're still fit to stand trial or not, technically. And that's happened a couple times too. So.
And you have the new court navigator who is
Yeah, so-
providing a lot of education.
Cayuga Counseling has that contract. That's part of the state aid contract that they have an amount allocated to that. They have the position posted. They have not hired anybody for that position yet. But there is some creative work I think we can do with that position as well, with them being in the court system. So
And
more to
as an
come.
advocate to the individual.
They're really meant to anybody who has like a mental health disorder and is in the criminal justice system. This navigator can help them navigate services, refer them to places, do SPO applications, get them connected with the right services, and advocate with them in the court as well. But I think we can use that position also to be pretty creative around how can we continue to educate around what the competent exam really is. It's not really sending someone for treatment. It's very different. They're just educating them on the court system and, what the elements of the court system are. Yeah.
About court.
Yeah.
Yeah.
It's very different than being,
Was the
treated.
It helps reduce anxiety knowing what to expect though. that-
mentioned before that there are bills in both the state assembly and state senate. To get back to this idea of what 730s are actually about.
Yeah, and it's really focused. I think they're really trying to change how restoration happens. Because there's a belief that restoration could happen in an outpatient setting. Why does it need to be inpatient? Why are we paying all this money for someone to be restored when they would have never met the criteria to be in a hospital to begin with? So it just doesn't really make sense. So.
A lot of credit to you and your team.
Yeah.
It's unheard of to be fully staffed. So whatever culture you've created must be working because the compassion fatigue and the burnout and the fact that you have fully staffed, that's amazing.
That was my.
Yeah, and-
thought, that there was a
And
great-
we have a very, very good team and, we're in a good place as far as I think how everybody feels there as well. So yeah.
Very glad to hear that, and
a lot of credit to them. They're doing a lot of hard work.
I'm sure would like to send our greetings to them, our thanks to
Yeah.
them for, this year's work and diligence and.
I will. Thank you very much.
Thank you.
Appreciate it.
Thank you.
Thanks.
Okay. We've completed the agenda. I'd like to- For a motion for adjourn,
I'll make it.
I'll second.
Sleepy.
all in favor?
Hi.
We are adjourned.